Welcome to The Explainer. Today we're digging into a really important health investigation that looks at a mysterious and, honestly, a deeply distressing childhood condition. We're going to uncover why the treatments being used are so controversial and what all this means for the families who are caught right in the middle of it. Okay, so let's just dive right in. I want you to imagine a child, totally healthy one day, and then, almost overnight, they are completely transformed. This is the frightening reality for families who encounter what researchers have started calling PANDAS.
So to really get this, we have to start by understanding the mystery of PANDAS itself and the incredibly high stakes for the kids and families who are affected by it.
Now, the first thing you need to know is that PANDAS isn't an established diagnosis you'd find in, say, the DSM-5. It's what's called a research condition. It's basically a label for a very real and incredibly severe cluster of symptoms that, frankly, science is still struggling to fully understand.
And when we say severe, the report makes it clear they mean severe. The absolute hallmark is that sudden, really dramatic onset of OCD or a child suddenly refusing to eat. And that's not all. It's combined with at least two other major neuropsychiatric symptoms that also appear out of nowhere, things like intense anxiety, aggression, or a sudden catastrophic drop in school performance. I mean, the impact is just devastating. The report says 2/3 of these kids can't even go to school for months, which put this enormous, unimaginable burden on their caregivers.
So, the big question, right, is what on earth could be causing this? Well, let's take a look at the main theory that has really guided the search for treatments.
The leading idea, the one the report really focuses on, is that this isn't a typical psychiatric disorder. The theory is that some kind of infection or another trigger causes the child's own immune system to just go haywire, to get confused and mistakenly attack their own brain. This idea of neuroinflammation, it logically suggests that treatments that target the immune system might be the answer. And that's exactly what this big Swedish health agency decided to investigate.
And that brings us to the real heart of this report. The investigators asked a pretty simple but absolutely vital question. Do these powerful immune-targeting treatments actually help? And, just as important, are they safe for kids?
Now, before we get to the findings, we got to understand how they rated the evidence. They used a system called GRADE. So, high certainty means we're really confident in the results. But look all the way down at the bottom. Very low certainty. The report is super clear about this. It means they have very little confidence in the estimate. In other words, the true effect is probably going to be substantially different from what the studies found. Just keep that in your head as we go forward.
Okay, first up, the report looked at some pretty common anti-inflammatory drugs. We're talking about things like ibuprofen and corticosteroids, stuff that's designed to directly fight inflammation. And here's the verdict. So while some early studies hinted that these drugs might help, the investigators found some big problems. For instance, something called confounding by indication, which basically means the kids with less severe symptoms were more likely to get the drugs in the first place, and that totally skews the results. So in the end, the certainty of evidence for any real benefit was rated, you guessed it, very low.
All right, the next category kind of follows the same logic. If infections are a possible trigger, does it make sense to use long-term antibiotics to prevent flare-ups or maybe reduce symptoms?
And you can probably see a theme emerging here. Even when they looked at randomized controlled trials, the gold standard of medical research, the report found no significant effects on those core symptoms like OCD or tics. So the conclusion was exactly the same. The evidence for antibiotics is a very low certainty.
Finally, the investigators turned to the heavy hitters. These are the most intensive, the most expensive, and the most invasive treatments. Therapies like IVIG and plasma exchange that directly manipulate a person's immune system.
And here it is, the final piece of the puzzle when it comes to effectiveness. For even these incredibly powerful interventions, the study still had major limitations. So the report concludes, for the third time, that when it comes to actually improving a child's functioning and reducing their symptoms, the certainty of any benefit is, once again, judged to be very low.
So, if the evidence for any benefit is just consistently weak across the board, what did the report have to say about the potential for harm?
And this, right here, this brings us to the absolute core of the entire report, a profound mismatch. On one side, you have benefits that are of very low certainty, and on the other, you have risks that are of moderate to low certainty. See the problem? The side effects are real, they are documented. We're talking increased psychiatric symptoms from corticosteroids, abdominal pain, nausea, fever from the other treatments. These things do happen.
The money aspect just adds another layer to this whole thing.
The report points out that some of the simpler treatments, like anti-inflammatory drugs or antibiotics, they're pretty inexpensive. They cost just a few Swedish kronor a day.
But look at this contrast. A single course of an intensive immunotherapy, like IVIG, can cost upwards of 46,000 kroner. That's thousands of US dollars. And it just raises these really serious ethical questions about using such expensive resources on a treatment where the benefit is so uncertain.
So, after systematically weighing all of the available science, the Swedish Health Authority came to a very clear, and I have to say, a very cautious conclusion about the current state of PANDAS treatment.
Here's the bottom line. The investigators say that the benefit-risk balance may actually be negative. Let that sink in. It means the potential for harm could actually outweigh the very uncertain chance of doing any good. Because of that, their final recommendation is that these treatments should not be used in routine clinical care. They should only be given inside the controlled setting of a research study, where every piece of data can be carefully collected and analyzed.
And that leaves us with this final, incredibly difficult question. It just perfectly captures the tension, doesn't it? The tension between the desperate, urgent need of a family to help their suffering child and that fundamental medical principle to first do no harm. When the evidence is this weak and the stakes for a child are this high, finding the right path forward, well, that remains one of modern medicine's most heartbreaking challenges.